did you know, online,
So today is a work on ER today. I uploaded. So usually we uploaded from medical surgical. We uploaded to ER, and one of my patient or three of my patient already take care of them before. One of my patient was alcoholic and he's taking phenobarbital. Phenobarbital is something that they use for detox because it's kind of a downers or sedative, but it doesn't cause the body to be addicted with it. My patient is alcohol withdrawal, and he's also taking clonopin. Clonopin is part of withdrawal medication. The doctor usually don't give Ativan because uh, Ativan can cause addiction too. Actually, my patient is positive and benzodiazepam, and this patient was already on. He, he was supposed to go on in-home patient rehab, but the patient didn't really went there. Instead, he drink alcohol and fell down in one of the supermarket. And I think the police brought him to the emergency room, and the doctor came in and ordered some withdrawal protocol or alcohol withdrawal protocol, and basically I don't work on ER a lot, but working on ER is a good experience. You'll see them how they work. I work on an overflow, which means that the ER nurse already assessed them. They're more probably would say more stable. The ER nurse already give the first intervention like IV fluids if they got really high blood pressure. They already did something about it. Usually they send the patient to medical floor, the medical floor overflow. So one of my other patient was having cyclic vomiting syndrome. They say that it was very rare disease, and not much of a people has that kind of disease. This cyclic vomiting syndrome, they usually treat the patient with Benadryl and other medication is another medication is what? Toracin. Toracin is antipsychotic, but probably it could help. Sometimes Toracin they use it for hiccups. So that medication also got Sopran. It's anti-nausea medication. Usually the dose of Sopran is 4 milligram. So I give one of 4 milligram Sopran every post today, and probably it helped. Most of my patients today are really stable. My other patient is he got infection on his left foot. He got osteomyelitis. He's a dialysis patient, history of acute renal failure. This patient is a big guy. He's very young. He's only 28 years old. And this patient is this patient has what does he have? He got like elephantiasis. He also had hypertension. Orthopedic doctor was called today, or called for a consult. And they say that they will see the patient. Um, this patient, because of osteomyelitis, he's suffering from pain. And he got a big wound on his left foot. It's positive for MRSA and culture. Um, so I'm giving Dilaudid on this patient 1 milligram every 2 hours. And Dilaudid is pretty high medication. I think it's 5 times more potent than morphine sulfate. Basically, this patient had low self-esteem, and he said that it's good for nothing. I just tried to comfort him, assure him that he is so that my patient doesn't have IV fluids, but he have IV access for that IV medication. The other patient which are alcoholic, according to ER, they don't want to put IV access on that patient because just in case the patient will want to walk out ER, he doesn't have the IV. He usually smoke. He's cautious. He's gonna ask me to go to. He will smoke and he'll be back in 4 minutes. So I just let him do that. Then my other patient, after I discharged the 3 patients, I got 2 other patients. And what happened is I got one of the patients which has cellulitis on left leg. This patient have history of cabbage or coronary artery bypass. Then he got triple bypass. He got an access to. He got access to 4. Ito nanay, makikita kayo sa YouTube.
Ano ba yan?
Ayan sa YouTube.
Yan ba?
Para ho kayong gumagawa ng movie rito. Kahit siyang lugar, makikita kayo kung gusto lang i-search. Ito, pakita ko sa inyo.